Hello. So this one is in a continuation of my talks on cancer and its detection. So I did talk about the CAT scan. I also talked about circulating tumor DNA, and then I talked about some of the old methods of treating cancers and some of the things which are still there but not used as commonly, like laser for intrabronchial radiation or those kind of stuff. So today I'm going to talk about the PET scan, and everybody knows about the PET scan, at least have heard about it if they have somebody that they know or in their relation who has a cancer of the lung or cancer of any organ. The PET or PET scan stands for positron emission tomography, and apparently it was invented several years ago, and it was done to see which part of the brain gets stimulated when certain functions are done. So it localizes the area of brain which is involved in certain decision making or perceiving the information type of things. And I'm going to go through the basics and then maybe talk about the PET scan for cancers. The PET scan is also used for Alzheimer's disease. PET scan is also used for cardiac or coronary artery disease, but commonly PET scan is used for detection or staging of the cancers. Cardiac PET scan is also very common. Alzheimer's is becoming common, but not as common yet. So the principle is that every cell in the body needs glucose. If you remember some of those older videos that I did on obesity and diet, every cell can pick up and metabolizes glucose, not fat, not fructose, not pure proteins. So every cell needs glucose and it uses it. The use of glucose will depend on the metabolic activity of the cell. So if your particular cell is metabolically overactive or active more than is usual compared to the surrounding cells, it will have more concentration of glucose in it. So this is the principle which is used, and it was the same principle that was used when we started doing the PET scan for the brain function or localization of which part of the brain is actively involved. There are a couple of things called functional MRIs and functional PET scan and all that stuff, but we are today concentrating only on the use of PET scan related to the cancer. So in this particular scan, it is a biological scan. What does it mean? It doesn't show the structure as such. That means it's not going to show a structure of the lung or structure of the liver or structure of the kidney, like the CAT scan shows. To give you a rough idea, if I would do a CAT scan on somebody who has died a few hours or a few minutes, and I do a CAT scan of his lungs, it'll look normal if he did not die of lung problem, or even if he died of a lung problem but not structural disease like pneumonia. Same thing will happen if you do a CAT scan on the belly in a dead person. You would still see the normal looking liver and kidneys and whatnot. Certainly the lack of circulation will lead to certain changes, and the dead tissue would be seen differently. But you get the rough idea. Please do not misunderstand that the CAT scan does not show any change when the tissues die. They do show it. But what I'm saying to you is that the structure looks the same. Functionally, it is different. For example, if I would do a PET scan of a guy who has an emphysema but no cancer, his PET scan of the lung would be perfectly normal. So in PET scan, they inject you with a glucose, or patient is injected with a glucose, which is tagged with radioactive material. The radioactive material has a short half-life. That means it does not remain in your body for a long time, that you're radiating anything to your neighbors, your spouse, your family, or anybody else. So they inject you with the glucose, which is tagged with the radionuclide material, and they do a scan of skull to the mid-thigh, which means the head, the neck, the chest, the belly, the pelvis, and even the lower extremity upper bones. So it literally looks like a skeletal picture with densities which you can vaguely resemble as liver or heart or lung, because heart has a lot of blood, so it will show some activity. Liver has a lot of blood, so it will show activity. Now, this has to be matched with the anatomical or structural images through a previously done CAT scan or a new CAT scan that they do, just to collaborate the findings of the PET scan. The glucose is picked up by every cell in the body. If there are hypermetabolic, metabolically active cells more than their average colleagues, then it will take more glucose. The radionuclide material would be concentrated more in that area, and this is picked up by the outside camera or images. So when you inject the PET scan material, which is glucose, which is radioactively tagged, scans are done about a couple of hours after that. The body has time to use glucose, and then we can see. So if somebody has a spot which is, say, 1 centimeter in size or 15 millimeter in size or even an inch in size, which is larger than 10 millimeter or a centimeter, we compare the metabolic activity of the glucose in that particular spot to the surrounding lung, and the value of that is measured in a unit called SUV. This particular SUV varies from 0 to whatever high, 15, even 18. And the metabolic activity higher is seen in cancers. If there is no metabolic activity, the possibility of cancer is very low. If there is a low metabolic activity, the chance of cancer is low but not totally ruled out. Again, this activity depends on number of cells, because number of cells determine the pickup of the glucose. So a 2 centimeter tumor is going to pick up more activity or more glucose with radioisotope added to it than a 1 centimeter. So certainly the metabolic activity also depends on the size. So it's kind of some kind of probability that we can give as to what's the chance of cancer. Now, the metabolic activity also increases in infections and inflammation. So sometimes you might see increased metabolic activity on PET scan, and that could be because of infection like pneumonia or inflammation, and it may not be always due to cancer. One might say, how accurate is PET scan in picking up cancer? I would probably say about 85%, maybe 88%. The limitations of PET scan is that the size. So a 1, 2, 3, 4, 5, 6, 7 millimeter nodules, which are nowadays detected quickly on screening CAT scans, like I mentioned in my last video, may not pick up enough glucose to be picked up by the camera, and even though it is cancer, it may not be detected or picked up. So 8 millimeter or less is less likely to be picked up on a PET scan. So our cutoff usually is about 10 millimeters. So at 10 millimeter PET scan is worth doing it, because if it does pick up, the chance that it is cancer is higher. As I said, infection, inflammation also can pick it up. So somebody who has a pneumonia or an abscess in the breast or in the skin will be picked up on a PET scan, even though it is not a cancer. The limitation also includes that of a slow-growing cancer. So if somebody has a very slow-growing cancer where the metabolic activity of the cancer cell is only slightly higher than the normal cells, then it may have a low pickup and may be missed. So PET scan is not gospel truth, it's not 100%, but about 85% accurate. So if you have a tumor, or if somebody has a spot which is larger and the metabolic activity is very low, possibility of it being cancer is reduced, but again, it does not give you the tissue diagnosis of cancer. So just to summarize, PET scan is good for spots which are greater than 8 or 10 millimeter. It is not a gospel truth, not 100%. And infection, inflammation can be missed. as high pickup on PET scan. And lastly but not least is that slow-going cancer may not have a high metabolic activity. Hope this explains something about the PET scan. I'll try to finish it up in my next video. Thank you for watching. Hope you enjoy it and like it. Thank you.